So what happens, what this process is called, is absorption. So the signal comes off the transducer by the reverse piezoelectric effect. Sound waves come out, they hit the dense tissue, they're turned into heat, and that's attenuation of the signal due to absorption. So the signal attenuates, you don't get as much of it back, and it's absorbed into the tissue itself. That attenuation occurs when sound waves travel through tissue and they decrease in intensity, in power, or in amplitude. Now, intensity, power, and amplitude, not really important for you guys to know those particular terms as they pertain to the clinical application of ultrasound, but just knowing that this is a phenomenon that's going to happen will save you headaches later when you're trying to figure out why you just can't see the darn thing you want to see on the screen and why it's not as crisp and clear as you want it to be. Because there may be some strategies you can use later on to help clean up some of this attenuation. And one of those strategies is to adjust your frequency. We'll get back to frequency later. But specifically, if you think about it and you realize that you've got some attenuation on your screen and everything's looking like a TV screen from the 1970s tuned to channel 3, if everything looks like that, you might want to start thinking about where your frequency is and realize that a higher frequency is going to attenuate more. So you may need a lower frequency to do a little better job. The other things that can happen, now that absorption, so here we go, here that electric signal is going to come down, it's going to go through the transducer by the reverse piezoelectric effect, go to the tissue, and so you don't get as much back. You get a narrower band back, and that occurs with absorption. This is a little bit, I realize that my conversion here, this is a little bit shifted over, but this is reflection here. So here the sound waves are coming down, and they're hitting a surface that is not exactly parallel. See, this tissue was parallel to the transducers, so the sound waves went straight back to the transducer. When the sound waves come down from the transducer on this side, they hit the reflective surface, whatever that surface is, and bounce away. So you don't get to see as much of them. Now, this is one of the things that happen in ultrasound. The third thing that can happen is called refraction, and it says refraction over here, but it should be over here. And that's where the signal comes down through the tissue and then is angulated. And all these things are happening in all different sorts of ways as you're scanning tissue and all the different types of tissue that you're scanning. So what the machine is doing is making sense of the various issues related to reflection, refraction, and the direction of the beam as they pertain to the structure that you're looking at. And for you to be aware that these phenomena exist becomes pertinent when you're starting to scan some structures. For instance, if you're looking at something and you've got a very dense, let's say, cross-section of a tendon, which is what we're looking at on this side of the screen. Now, forget about what tendon it is, and because we'll get to that later. But what you see here is a very dense tendon, and then if you can make out just a little bit on the edge of this tendon, you almost get this little curved shadow which comes down. Well, you can kind of see it over here too. Here's another tendon. Here's a curved shadow which comes down like this. That's a refraction of the sound waves as they come down and hit something dense, and then refract. They don't pass straight through this dense object here. They pass around it and they're angulated, and that's all dependent on the speed of the wave and how much impedance you have. So something that's super dense in the middle of your tissue is going to cause this refractile shadowing, okay? But if you pay attention and look for that refractile shadowing, what it'll do is it'll prevent you from calling something that's in this area pathologic later on. So the physics becomes important because it becomes a relevant thing day to day when you're scanning and making sure that there's something that's not pathologic in your picture. Reflection. Come with me on a little trip and remember the time when you were 5 years old and it was the first time you went and took a jump into the water, into a swimming pool. And this was before you realized that chlorine burned your eyes. And you looked up to the surface, and it was a bright sunny day, and you looked up to the surface and you saw the top of the water, and the water was reflecting back at you. It looked like a mirror. That's reflection. What happened was the light wave came down into the water, tried to come back up, hit the surface of the water-air interface, and bounced right back to your eyeball. The same thing's happening here on the screen. This is kind of cool. This is the inside of a joint. Well, let me start with the bright stuff here is the capsule of the joint. It's thick. The dark stuff here is water, fluid, joint fluid. The dark stuff here is cartilage, right? So you've got dark stuff here and you've got dark stuff here. One is water and one is cartilage. But then there's white stuff in between. What is that white line? That white line is reflective surface. That is the surface of the pool. The sound waves, like the light waves that were hitting your eye, come down and hit that interface between a water surface and a cartilage surface and bounce reflectively back up. This is a mirror. This is a mirror. Not to be confused with the bright line that we see underneath it, which is bone. Okay? So the more you scan, the more you pick these things up, and the more excited you get about physics. Well, maybe not, but you start to really start to think about these things.